Okay guys, good morning. So today let's discuss the last two phases of the nursing process, which are the implementing and the evaluating phase. So we're done discussing the assessment, the diagnosis, and the planning. So now let's proceed to the last two portion. Okay, so make sure that you have already understand the basic on how to utilize or navigate your own handbook so that it will be easier for you to um add this topic, the implementing and the evaluating phase. Okay, what is implementing? So it consists of doing and documenting the activities that are specific nursing actions needed to carry out the interventions. So what is the relationship of implementing to other nursing process phase? So bakit importante ang implementing phase? So the first nursing process, the ADP, can you still remember the ADP, which is the assessment, the diagnosis, and the planning, provide the basis for the nursing action performed during the implementing steps. So katong mga previous steps nato nga na-discuss, that would serve as your basis, that will serve as your foundation. Kasi kung unsa imuhang na-gather na data out from your assessment to planning, maupunay mo ang ma-formulate na implementation. So just make sure that your assessment and the diagnosis correlate to each other at the same time. It's timely and applicable to the patient so that your implementing phase would not be a problem at all. Okay? So using the data acquired during the assessment phase, the nurse can individualize care given to the client. So always remember that your care should be individualized, okay, not standardized. It should be unique because our patient has its own specific and unique needs, okay? And always remember the nursing care, the nurse continues to reassess the client every contact. So what does it mean? Ang pasabot ni mo, miss? Nga human naman tag-assessment, why do we need to go back to assessment phase while implementing? Example kasi, well, bathing the client is an implementation, right? So, but you have noticed is that client has reddened blisters in the back portion. So, bathing the client is implementation, but as you go along with your implementation, that's also a part of your assessment. And that's the portion in which you can assess the extremities of the client, the gait of the client, and the responses of the client. So, for example, while giliguan mo ang pasyente, kasi guys, we are utilizing US-based book, and in America, nurses are the one who bath the client. Unlike here in Philippines, we are not actually required to help the client in bathing. Pero sa Amerika, kailangan na to sila tabangan. So, while bathing the client, which is an intervention phase, okay, di ba ang pagligo sa client, implementing naman ang phase, but we have to continue to reassess the client para ma-notice na to ang mga changes, okay? Or another example would be, while draining or emptying the urinary catheter bag, okay, the nurse measures 200 ml of urine. That's your implementation phase, okay? That's you're carrying out your nursing intervention. Kana ang pasabot sa nursing implementation. You've noticed that you actually smell offensive smelling brown urine, which is also part of assessment. So, mo na pasabot na while we continue to render nursing care, it also a sign or a continuous of the reassessment that we perform towards to our client. Gets ninyo why it's considered, okay? Now, there are three implementing skills that we have to apply. So, what are those? The first one would be cognitive skills. So, from the word itself, it's explanatory already, self-explanatory, that it is more on intellectual skills that includes problem solving, decision making, critical thinking, clinical reasoning, and creativity. So, mao na ang cognitive skills. And remember, we have three implementing skills that we have to adopt to be an effective nurse. They are crucial in providing safe, intelligent nursing care. So, syempre, pag wala kay proper decision making, wala kay problem-solving skills, so that would really put you into a difficult position. Kasi hindi mo man alam kung paano i-implement hindi mo alam paano i-interpret ang data out from your assessment. So that is why it's really important to develop your creativity, to develop your critical thinking skills so that you can provide quality care towards your patients. Now the second one would be interpersonal skills, the way you interact with other people, your communication skills, right? So are all activities verbal and non-verbal people use when interacting directly with one another. It just not the patient alone, it also to your colleagues, to your senior nurses, to your nursing assistants, and to the healthcare physician. So the nurse uses therapeutic communication to understand the client. Okay? Kasi sabi, way back then when I was college student, we are always told na your patients are abnormal. So you treat them as an abnormal one. Kasi nga, di sila normal kasi they are facing crisis, health crisis, right? So you have to treat them and you have to really continue to be patient, continue to do everything just to provide a quality care to your patients. So, pasabot dili ni mo patulan. Okay? A nurse should work effectively with other members of the healthcare team, of course. The nurse cannot perform alone, cannot provide quality care to the patient alone. The nurse needs a partner, which is a nursing assistant, a collaboration with the healthcare team, the doctors, the respiratory therapists, the medical technologists, and the radiologists, that we have to collaborate with each other to provide the safe and intelligent care towards to the patient. So necessary for comforting. So what are the purposes of having or developing our interpersonal skills and as a nurse? Of course, it would help when we are comforting our patient, we are counseling and supporting. So before a nurse can be highly skilled on this, they must have self-awareness and sensitivity to others. So how can you be a good communicator? How can you be a good nurse, effective nurse, if you have some personal issues? So make sure that you have to perform self-introspection first, or shall we say the self-awareness phase, in which you could assess yourself sa mga weaknesses, sa batasan nimo, ganon. Because through that self-awareness, you are opening yourself to a more healthy, communicative, more healthy, interactive relationship with your client. The third but not the least would be technical skills. So, Miss, what is technical skills? Are purposeful hands-on skills such as manipulating the equipment, giving injections, bandaging, moving, lifting, and repositioning the clients. So when you're giving medication, when you're giving intramuscular injection, intradermal injections, that's your technical skills. But mind you guys, when I was a college student, I am really having hard time to do some IV cannulation. As in, super kurog jud kay akong kamot. So, I cannot really perform well because I am anxious. But as you go along with the journey as a nurse, when you go, nag-work naman sa hospital, you will really practice a lot. Ma-develop rin yung mga skills. Kasi ma-develop naman siya as long as you are willing to learn. As you are willing to accept criticisms, you are willing to accept facts from your colleagues as a sort of improvements naman. Okay? Just take it as a constructive criticism every time your colleagues will tell you something. Okay? That's my challenge to you guys. As of now, you cannot actually realize it. Yeah, I'm not good with this. Kurog ko, miss. I'm not good with that. Kasi, miss, ganito, ganyan. But guys, along the way, when you work as a nurse in a hospital, you learn a lot of things. Okay? This skills is also called a psychomotor skill. So what is another term of technical skills or psychomotor skills, which defines as a physical actions that are controlled by mind and not reflexes? Because how can you perform an equipment if you don't know how to do that? Like that, okay? So you really have to develop first your and you have to adapt first the concepts, the fundamental concepts before you can perform a specific procedure. So it requires knowledge and frequently manual dexterity. What does it mean? It requires frequent update. Okay? What are the 5 process of implementing? The first one is reassessing the client. So we've already discussed this one. Katong, while you're doing implementation, you have to reassess the client to make sure the intervention is needed. Okay, because if your intervention, for example, you know the initial temperature is 38.5 and you perform tepid sponge bath or the TSB towards their client, and then now after reassessment you've noticed that it was actually lower down to 36.4, which is a normal body temperature. So now by doing the reassessment, you are aware that you're not just doing the intervention all over again because it was actually goal met na. So dapat kung na achieve din mo siya, goal met na nimo, you don't need to do it all over again. You have to find something problem with regards to the current condition. So initially, your nursing diagnosis is disturbed sleep pattern because nakita gulo nimo your patient cannot sleep well because of the unfamiliarity of the environment. But during your subsequent rounds, so your second or third rounds, you've noticed that your clients sleep well. So your disturbed sleep pattern is not really applicable na sa pasyente. So now you have to really need to change your diagnosis for that. Gets niyo? Okay, now the second one would be determining the nurse's needs for assistance. So the nurse is unable to implement the nursing activity alone. Usipin yun ninyo na. Kaya you have to establish a good relationship with your nursing assistants and with other member of the healthcare team. Kasi you cannot, no man is an island. You cannot actually perform a basic procedure, even certain procedures. Some of the procedures, kasi you need help, you need assistance from your team. Like for example, ambulating the obese client. Kasi guys, as what I've said a while ago, here in the Philippines, we really don't need to help the patient ambulate after a particular procedure. But in America, we have to help them because it's part of the nursing intervention when we ambulate the client safely. Okay? Assistance would reduce stress to the client, like turning the client, especially obese clients who are undergoing a procedure. And always remember that we need to reposition the client every 2 hours. Of course, pag dili restricted. Kasi guys, to prevent, our rationale for that is to prevent pressure sores or the cubitus ulcer. Kasi guys, pag ang patient naka-supine position, and their mga skin became sensitive and that may lead to pressure sores. That's why we really have to turn the patient side by side. The nurse lacks the knowledge or skills to implement a nursing activity. What are the third step would be implementing the nursing interventions. It is important to explain what interventions will be done, what sensations to expect, and what the client expected to do. So it's very important before you perform a procedure, you have to explain to our client. Kasi masyak man yan sila, oy, kung hindi mo sabihin, di ba? So like for example, ma'am, mag-perform ko og skin test, which is intradermal injection. Ma'am, mag-perform ko og skin test. Kinahatag natin siya, it's because we are going to start the antibiotic or the doctor will going to start an antibiotic. But ma'am, you will feel a slight discomfort because it's really painful to have this intradermal injection. So just explain to the client the importance of that. Sa expected nila nga mabati, sakit ba na, hapdos ba na? So that they will going to understand the process. It's not just you're going to go to the room to the patient, just inject the intradermal injection or just give the medication without explaining everything, okay? Because we are actually breaching the right of information of the client. Gets? Okay. So close the curtains, you have to drape to give privacy to the client. So note, when implementing intervention, the nurse must follow these guidelines. Must be aware the scientific rationale as well as the possible side effects or complication of all intervention. So meds are taken with meals or prior meals. So you have to be a knowledgeable nurse. Okay? So if you have really problem, if you are really concerned, excuse me. Okay, so there are actually medications that are taken with meals and there are medications that are properly absorbed without meals. So before giving medication, you really have to make sure that you, as a nurse, are aware what are the contraindication and what are the precautions of the medication. Okay? Next would be client understand the interventions to be implemented. Okay. And the gather data if the client has any allergies of the medications. So there are clients who are allergic to an antibiotic. So you really have to note on the client's chart or refer it to the physician so that they will going to change or they will going to shift it to other medications. Next would be implement safe care, meaning sterile technique when applying dressing. So do not breach sterility, okay? Because that would compromise the patient. That would lead to infection if you breach the sterility technique. So when you are doing dressing, make sure you are wearing a sterile gloves. So make sure it's sterile, okay? Provide teaching and support. Be holistic. And what does it mean? It means you're not just looking after the physical aspect of the client, but of course the other aspect as well, like the mental aspect, the psychological or mental or psychological, and the other aspect, the emotional aspect of the patient health. Okay, respect the client dignity and enhance his or her self-esteem. So as a nurse, you have to help your client to develop their self-esteem. Okay, their confidence. Okay, encourage client to actively participate in all nursing activities, meaning that you have to be a collaborative nurse. You don't need to initiate, you don't need to make a nursing care plan na sa imuha ikaw lang naghimo. You have to ask the patient perspective, you have to ask their patient ideas about that. What are those interventions that they preferred, and what are those interventions that they don't want to apply to their health. But of course, it must be related to the order of the healthcare physician. The fourth process would be supervising delegated care. So we cannot actually, as what I've told you kanina, our nurses cannot do alone, or nurses cannot survive alone in the ward. They need to have their nursing assistants, their doctors, and etc. Kasi guys, some of the activities can be properly delegated or properly mapapalihog mo sa nursing assistant, like doing a KSS, like after terminating intravenous fluid, doing a Foley catheterization. Some of these are delegated to the nursing assistant. But always remember that when you are delegating the nursing activity, you are retaining an accountability. So accountability ni mo na siya as a nurse. That's why you really have to supervise, especially if your nursing assistant is a novice, bago lang, okay? So you really have to make sure that you have supervised, make sure that it's safely implemented towards the patient. So the nurse validates and responds to any adverse findings or any client responses. It involves modifying the nursing care plan. Next would be documenting nursing activities. Okay, so after carrying out the nursing activities, the nurse complete the implementing phase by recording the interventions and clients' responses. It's very necessary, it's very significant, guys, to always record, to always document everything you have done to your client. Kasi what is not recorded is not done. Okay, that's your what is not documented is not done. So pasabot kung yung ma'am naghatag man ko anag nag-TSB man ko ana, ma'am nag-tepid sponge ba't man ko ganina alas 5 pagkalintura sa pasyente, but you didn't document it. So pasabot wala ni mo nabuhat. Okay? Nursing care must not be recorded in advance. Remember, di mo wala ka kabalon sa possible mahitabo. So, i-advance din mo, feeling niyo magkalintura ay mo pasyente unya alas 8. You advance din mo charting. No, it's not like that. Once you perform a particular procedure, document it right after. That's the perfect and the most ideal. Okay? Example, giving morphine to a client is a physician order. But you notice that the respiratory rate of a client is 8 breaths per minute. Always remember, guys, morphine is respiratory depressant. I know it's actually early for me to introduce this to you, but of course, I want to share this. Morphine sulfate is respiratory depressant. And what is the normal respiratory of your client? It would be 16 to 20 cycles per minute. That's the adult normal respiratory rate, right? So, but you've noticed that your client, or before giving medication, you notice that your respiratory of the guy is 8 breaths per minute. Possible they are respiratory depressed already. So, possible morphine is no. Okay, it's a contraindication. So you would hold the morphine and record it and refer to the physician. Gets? So that is why you really have to be a knowledgeable nurse. Kasi pag hindi mo alam na ang morphine is a respiratory depressant medication, you give the morphine to your client kasi nga hindi mo alam, tangers ka o ganyan. That would lead to respiratory arrest. Mas mababa ang respiratory rate sa patient. That would lead to cardiac arrest. Okay? So you have to be a knowledgeable nurse here. Okay, so always remember that one. The fifth process, or the fifth phase of the nursing process, is the evaluating phase. Okay? So we're almost there, guys. Hang on. Is the fifth phase of the nursing process is a planned, ongoing, purposeful activity in which the clients and healthcare professionals determine. So we have to determine the client's progress, if it's the client is improving or the client is deteriorating. So the effectiveness of the nursing care plan. So evaluation is continuous and should be done well or immediately after implementing a nursing order to enable the nurse to make an on-spot modification and interventions. So while katong explain ako sa imo na while implementing, while giving medication, or while doing a certain implementation, you have to continuous to assess the client. So through this, the nurses demonstrate the responsibility and the accountability for their actions. So there are 5 components of evaluation phase. The first one would be collecting data. So using the clearly stated, precise, and measurable desired outcomes. The nurse will collect data so that the conclusions can be drawn about whether goals have been met. Okay? So I'll be given the first number. So now I'll be giving a 3 sorts or 3 pairs of number. You have to attach it to the Google Classroom, and it will serve as your attendance. Okay, the due of this will actually this coming Saturday. So I'll give you allotted time to actually watch this lecture so that you will be able to guess the code and you have to attach it to the classroom. Okay. The first code would be 20. Okay, necessary to collect both subjective and objective data. So don't forget this ha, dili magtanga-tanga guys, dili maglimot-limot because this is basic, okay? When you say objective, it's measurable. When you say subjective, it's the patient can only feel that symptoms, okay? The client complains of stomach ache worsen even after breakfast. But you have noticed that the client has a relaxed face, normal vital sign. Okay, that's opposite. Your client is complaining stomach ache, sakit ako siyan, ma'am, sakit siya kayo, ma'am. But look at their face. It's normal. The vital sign is normal. So, palang dili sila complementary. Okay? Comparing data with desired outcomes. So, both the nurse and the client play an active role in comparing the client's actual responses with the desired outcomes. The nurse can draw one of the 3 possible conclusions. I think this was actually introduced to you way back then, but I have to introduce it all over again to you so that you could understand. The goal was met, meaning that the client response is same as the desired outcomes. The goal was partially met, that either a short-term outcome was achieved, but the long-term goal was not, or desired goal was incompletely attained. Okay? Next would be the goal was not met. What do you mean was incompletely attained? For example, you're doing tepid sponge bath to a febrile client, but you've noticed hindi siya talaga nag-normalize. Because the normal temperature is 36.5 to 37.5 degrees Celsius. So now your client was having from 38.6 nag-37.9, which is considered febrile pa rin, but nag-decrease siya. So the goal was partially met. But the goal was not met because wala gyud siya nag-improve. Okay? Note that evaluation statement consists of 2 parts. a conclusion, and a supporting data. Goal met. So what are the supporting data? What is the supporting data? The oral intake 300 ml, more than output. Skin turgor is resilient, and mucous membrane moist. Like for example, goal met. Ano na goal met mo siya? It's you have to base it on your planning. Okay, for example, sa planning mo, within my 8 hours of shift, my patient will be able to display a normal breath sound. Okay? Doon sa mo, if na-met nimo ang imuhang ang imuhang goal, that would goal met, normal breath sounds achieved within 8 hours of shift. Okay? Ganyan. So, don't forget that your evaluation should rely to your planning. Kung saan mo na-formulate sa planning. Drawing conclusions about problem status. Okay, when goals have been met, the nurse draw one of the following conclusion about the status of the client. So when the actual problem in the stated nursing diagnosis has been resolved, or the potential problem has been prevented, the nurse will document that the goal has been met and discontinues the care for the problem. So when, for example, nag-met na ng specific goal, you don't need to proceed it. Okay, you don't need to continue the intervention. You have to change your intervention and assess the client all over again and to identify unsa na po ang iyang problem. Okay? Dili kay na-solve na nimo, balik-balik ko nimo. No. When the potential problem stated in the nursing diagnosis is being prevented, but the risk factors are still present, the nurse will keep the problems on the care plan. When the actual problem still exists, even though some goals are being met, the nursing intervention must be continued even though 1 or 2 goals are met. Okay? Gets niyo? So, it's self-explanatory. And when goals have been partially met or goals have not been met, this would serve as your standing or guidelines. The care plan need to be revised since the problem is partially resolved. The revision may need to occur during the assessment and so forth. Kato akong ginaingon sa inyo na when you are doing revision, you have to do this all over again to assess the patient timely. Okay? The care plan does not need revision because the client needs just more time to achieve previously established goal. So, either the two. Pwede nimo siya i-revise kasi nga wala na resolve ang problem, magsugod kag assessment, pero pwede po tagaan sa nimo ang time ang patient to, to adapt or to achieve the established goals. So, mao na imong pwede himuon when you're experiencing partially met goals or goals that have not been met. Okay? Now, let's go to continuing, modifying, terminating the nursing care plan. So, before making modification, the nurse must determine the effectiveness of the plan as a whole. So, I will give you the number. The second number will be 36. So, okay? So, before making modification, the nurse must determine the effectiveness of the plan as a whole. This requires a review of entire care plan and critique of each step of the nursing process involved in its assessment. Okay? You have to, development, you have to critique each step. You have to assess each step kung asa ka na nakulang, asa ka na numbra. Quality assurance program. So don't forget this term, guys, because this is really important. What are the differences between quality assurance program and nursing audit? Okay, now let's discuss it one by one. Quality assurance program is an ongoing, systematic process designed to evaluate and promote excellence in the healthcare provided to clients. Limited to the evaluation of performance of one nurse or more involved in the evaluation. So it focuses on one nurse who performed the particular interventions, who are also belong to an evaluation phase or evaluation process. It requires evaluation of 3 components of care, which are the structure, the process, and outcome. Remember that structure, process, and outcomes belongs to quality assurance program. So now let's discuss what are those 3 structure, process, and outcome. Structure evaluation focuses on the setting in which the care is given, meaning the hospital itself. a desirable environmental and organizational characteristics that influence care, such as equipment and staffing. So now, during quality assurance evaluation, the evaluator should assess the capacity of the hospital, the equipment, if they are up to date, and of course the staffing, or the nurses and the doctors who are working in the hospitals, if they are understaffed or overstaffed, of if they are actually divided fairly. Now, what is process evaluation means? Focuses on how the care is given or the method. Okay, if the care is relevant ba, complete, and timely. Example of this is checking the kind identification prior medications. And this is part of process. Always remember, guys, the 7 rights of medication. Along the way, if we have ample of time, we will be able to tackle the 7 rights of medication or 8 rights of medications, and so other topics as well. But as of the moment, as of now, as early as now, you have to make sure that before giving medication to the client, you have to verify first, kasi there are actually chances that you will give it to the wrong patient. Okay, next would be outcome evaluation, meaning demonstrable the changes in the client's health status as a result of nursing care, meaning the outcome or the effect of your intervention, client responses or health status. Okay, remember there are three: the structure, the process, and outcome in quality assurance program. Quality improvement. Which means, what is quality improvement? How is it differ? How it is differ to, what is the difference rather to quality assurance evaluation? Quality improvement, it follows client rather than organizational structure, focuses on the process rather than individuals. Okay, client care, okay, uses systematic approach with the intention of improving the quality of care rather than ensuring the quality care. So the focus of quality improvement is improving, okay, the quality care. Identifying and correcting a system's problems such as duplication of services in the hospital. So mao ng quality improvement. This is also called as TQM, or the Total Quality Management, Performance Improvement, or PI, or PQM, or Persistent Quality Improvement. Okay, so somehow in board examination, there is actually question there that what is the purpose of quality improvement? Of course, to improve quality care. May mga option doon. To improve quality care, to ensure quality care, and so forth. Your answer will be improve quality care. Now, let's proceed to nursing audit. Okay, now I'll be giving you the four are the third or the last code, which means it's 88. Okay. Now, so our code is already complete. Dali na lang. Neck. Our code is already complete. So, you are now able to attach it to your Google Classroom. Nursing audit refers to the examination or the review of records. A retrospective audit is the evaluation of the client's record after discharge from an agency. But the general definition of nursing audit refers to the examination or the review of records. And there are two nursing audits: retrospective and concurrent audit. Retrospective is the evaluation is conducted after discharge. When it's a concurrent audit, is the evaluation of client healthcare when the client is still receiving care from the agency. So naa pa siya dira. Okay? Well, what is the purpose of nursing audit? Of course, to examine or review of records of the client. So this evaluation, so don't forget the retrospective and concurrent audit, guys. This evaluation uses interviewing, direct observation of the nursing care, and review of clinical records. The last but not the least is peer review. Okay? Peer review is to appraise the quality of a nurse performed by other equally qualified nurse. Kasi may ma-perform aning peer review. Of course, your colleagues, your other qualified nurse. They are going to assess you if you're qualified, if you're competent, you're skillful, you are knowledgeable to that, based on the pre-established criteria on standards. So there are two types of peer review: the individual peer review and The nursing audit. So a nursing audit is also part of the peer review. Okay. Individual peer review is focuses on the performance of an individual nurse. They are looking to the individual aspect of a nurse. And nursing audit focus on evaluating nursing care through the review of records. And there are two, remember, concurrent and retrospective. Retrospective is done right after the discharge. Concurrent is performed when the patient is still admitted into the healthcare agency. The success of audits depends on the accurate documentation. So that is why we really have to document every intervention that we perform to our clients. Okay? Okay, that would be all, guys. So make sure that you have watched these lectures and you've submitted a code into our Google Classroom so that, of course, you will be graded 20 points for your quiz at the same time attendance. So when you're able to submit it in a timely manner, you will receive 30 points. So that would be 20 and 10 for your quiz and your attendance. Okay? So don't worry, I will be extending the deadline for the watching of the lecture till Saturday. That will give you so much time to watch this lecture. Thank you so much, you guys, for listening, and I hope that you learned something for today. And plus, please prepare for a quiz next week, and that will be conducted through Zoom. And I will be meeting you through Zoom next week so that we'll be able to discuss the 5 phases of the nursing process and how we will going to implement it, on how we're going to formulate a nursing care plan. So we are done with ADP or ADP. The remaining two portion or the remaining two phases will be discussed next week through Zoom. So make sure you have your Nanda with you, your pocket book with you, so that it will be easier for you to follow the phase of the nursing process or the in formulation of the nursing care plan. So that would be all, guys. Thanks for listening and have a good day, everyone. Thank you for listening. And I really encourage everyone to watch this lecture. Bye bye, guys.